Nationally, we're all living longer, which is fantastic, but that means that individuals may have more complex health and care needs.
What anyone will tell you, particularly in frailty, is that trying to get the right care in the right place for the right person is extremely difficult. And that's if you're a carer, if you're a patient, or also if you're a staff member. The right place is not often hospital, particularly as you get older. You get what we call deconditioning, which is where your muscles get weak. So you lose about 10% of your muscle mass if you're over 85 in about 10 days. That can be the difference between independence and dependence.
Across North West Surrey, what we're trying to do is bring organisations together to work in a more integrated way to support people and provide them with wraparound personalised care.
Our main aim is admission avoidance. It's about keeping the person at home where they want to be and keep them well.
However, if they do go into hospital, what we really want is that team approach to get them out as quickly as possible, because we know people are better in their own homes.
My specialty is frailty, to assess patients, especially on the front door, identify their problem by doing a comprehensive genetic assessment, then formulate an appropriate plan and refer to appropriate team members to address those issues, and then try to turn them around and avoid admission in the hospital.
Our team is a team of generic therapists that consists of physiotherapists, occupational therapists and support therapy assistants. Our aim and role is to provide an initial assessment when patients come into A&E and make our recommendations onwards to the appropriate community services.
The Urgent Community Response Team is a service that's based in the community in Woking, but we cover the whole of North West Surrey area. We're a team of therapy staff as well as nurses. Our team are able to do a full assessment in the patient's home. We're able to provide equipment, we're able to assess function. We also work very closely with our adult social care colleagues to enable packages of care to be put in place to enable somebody to remain in their own home.
I am a senior social worker and I'm part of the integrated discharge unit. My role as a social worker in the team and part of the Home First team is to assess adults with care and support needs. Because in the past, when we didn't have the social care team based in hospitals, assessments took a lot of time, which meant we had a lot of delayed discharges. Now what happens is, as soon as someone is identified, we look at their care support needs. For instance, Mrs. Williams needs support in the morning for washing and dressing, support at lunch for meal preparation. We put that in place and then we make sure that Mrs. Williams is discharged home safely.
I work as a part of the wider integrated Home First team, providing holistic support and person-centred care via the district and borough services. And I feel like we work together and have the same aim, which is keeping patients independent within their homes, as well as trying to reduce hospital admissions. For example, community alarms and that supporting patients to, feel confident in their home.
The way we're working now has really improved the way patients are looked after in their own home. It's meant that we're not working in siloed care, we're actually working together in a joined up way, which is patient-centred and much better for the patient and their families.
Going forward, we want to try and develop a single point access, because we know that access into the system can be from multiple different sources and can get very jumbled in the process. If we can provide the right person to do that right job, then the system has more capacity to help more people and you're not on a waiting list for longer. So in so many ways it means that we're working better together for the patient.